This is the Fix Your Sciatica podcast.
And we are back. Last week, we mapped out the hardware and the physiology of the anatomy of the sciatic nerve and how it actually sends signals to your brain and the process on how it heals when it comes to it being irritated. Today, we're going to be moving from where it is and what it is to how it actually behaves. So if you ever felt like your sciatica is a complete mystery, you just couldn't quite figure out how to treat it, then today is for you, because we're going to become what I like to call movement detectives. And we're going to be focusing on finding patterns that are going to ultimately dictate your treatment. So here's the truth that most people find it hard to believe, is that your MRI is often not a crystal ball. So we've been conditioned to think that if we find a disc herniation, arthritis, or stenosis, or some other thing, that it must be the cause of our pain. Now, I do have to say, MRIs are very good at spotting any sort of medical red flags, so tumors, cancers, and fractures. But on the flip side, I've seen patients with 10 out of 10 pain whose MRIs look relatively clean or normal. And so this means an ugly MRI does not always guarantee pain, and a pretty one doesn't guarantee health or lack of pain. So if diagnosing a specific structure, like a disc or a joint, is unreliable or can be unreliable, then what is the next thing? And so the answer to that question is going to be looking at the pattern of movement and behaviors. And so we are going to be breaking up movement into three major columns. So to find your pattern, I need you to take an inventory of your pain and how it behaves. So what I'm going to have you do is grab a sheet of paper or open a new note on your phone, and we're going to create three specific columns. Column number one is going to be called the green zone, or what makes you feel good. You're going to list every position, exercise, or activity that makes you feel better, good, even just for a few minutes. And nothing is going to be too strange. I'm going to pause right now and have you write it down. But before that, examples. Does it feel better that you're twisted to the left? Does it feel better when you're lying flat on your back? Does walking feel great? So no detail is too minute. So go ahead and pause right now and write everything down. Take some time thinking about what actually feels good for your body. When you're ready, we then transition into what is called column two, which is the neutral zone, which is where we're looking at what doesn't make any change at all. So you're going to list the things that are just fine. They don't make you feel better, but they definitely do not make you feel worse. These are going to be your relative safe spaces where you can kind of exist without the fear of a flare-up. Again, I'm going to have you pause this episode, write down the neutral zone, and then press play when you are ready. And here we are, column number three, what we call the red zone, or the triggers of the alarms. And so what I'm going to have you do is list every activity, exercise, position that actually produces your pain or makes it worse. In sitting, is it bending over to tie your shoes? Is it standing? Is it carrying your kid? Again, you're going to pause this episode one last time, write down everything that makes things worse. And then when you're ready, press play. So now it's time for us to connect the dots and find a common thread. So you're going to be looking at your list, going to be looking for what we call mechanical commonality. So you're going to start with the positives. In your green zone, what do you notice those exercises, movements, positions, what do they all have in common? If standing, walking, and lying flat on your feet feel good, then your body prefers probably an extended low back or maybe neutral, and which means that your spine likes to be slightly arched or upright. If you feel better when you're curled up into a ball or sitting, your body might prefer flexion. Now we also have to look at the red zone. Oftentimes, these are going to be the exact opposites of the positive positions that you just discovered. If standing feels great, which is extension, but sitting feels like a lightning bolt into your butt, most likely flexion, then we found what is called your directional preference. And this is the key to your recovery, because our goal is to emulate your green zone positions throughout the day and neutralize those red zone areas or movements, either by doing them less or by changing how you do them so they don't trigger an alarm. So what's next? When you have this index, you have something much more valuable than an MRI, and also much less expensive. You have a manual for your own body, and this is where we can actually start to determine is a root cause of this pain due to your low back, your pelvis, your hips, or is it a combination of both? And when we see these patterns, the path to the right treatment becomes more clear. So your homework, I'm going to have you carry this list with you this week. If you discover a new green zone position or a new red zone trigger, you're going to add it to your list. We're going to be looking for some sort of consistency. And next week, I'm actually going to be breaking down the specific treatment strategies for each of these movement patterns so you can finally start moving and feeling a lot less pain. See you soon.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.